All right, well, we are just going to get started. Thank you so much for everyone that is here. We've been so excited to have this webinar. We have here Dr. Stacy Loeb and Dr. Samuel Washington, who are our prostate cancer experts. Doctors, you want to introduce yourself real quick? Dr. Loeb, if you want to start.
Hi, everyone. I'm Stacy Loeb. I'm a urologist at New York University and the Manhattan VA. Very excited to be here today.
Hi, everyone. My name is Samuel Washington. I'm a urologic oncologist, University of California, San Francisco, and San Francisco VA.
Awesome. Well, thank you guys so much for being here. Thank you to a couple of you actually sent some questions ahead of time. So we're going to stop sharing the screens, have us come up here, and we're going to get started. So the first question that we got is prostate cancer genetic? So do two of you want to tackle that?
For sure. Yes. So there's definitely some genetic contributions to prostate cancer. There have been some really interesting studies where they looked at twins, actually, and the difference between identical and fraternal twins in terms of prostate cancer risk to try to sort out how much of it is genetic. And it's right around 50%, actually. So that is like a pretty high proportion of genetic involvement for a type of cancer. But I think that still leaves the door open for the other 50% where we can make contributions from things like, a healthy lifestyle. And definitely there's a lot more going on around prostate cancer genetics these days. In fact, genetic counseling and genetic testing can be very helpful for patients with advanced prostate cancer or other patients who, either are at risk for prostate cancer or have prostate cancer who have multiple family members with history of cancer. So those are some great services available, especially genetic counseling, to just explore what kind of genetic risk you may have for prostate or other types of cancer. Dr. Washington, what do you think?
I completely agree. I was just going to stress knowing your family history, knowing whoever else in the family has a history of prostate cancer or some others is important. Not so much that you'll have the exact same disease that they will, but it does raise questions about your risk. So knowing those things up front can get you connected to genetic counseling and help us understand what your risk of having prostate cancer. Definitely impacts our discussions even around prostate cancer screening. So knowing that information is very important.
And that's such a good point you make, Dr. Washington, about knowing family history. And, I think historically, people were most focused on, like, do I have a family history of prostate cancer? And what a lot of people don't know is that even cancers in female relatives, like breast cancer or ovarian cancer in a female relative, may actually be related to the risk of prostate cancer. So really important to share with the doctor, any family members who have had cancer, male or female.
Awesome. Thank you guys so much. Now our next question is, what are some symptoms? Why, if people start seeing certain things, when should they go to their doctor?
So I think a lot of times what we'll see in clinic is patients who have symptoms of a larger prostate. So difficulty with urination, trouble at night, trouble initiating their urination or their stream. And that will lead to a PSA being drawn. Typically, if the cancer is contained within the prostate and small, which is the way we want to catch it, you won't really have many symptoms from the cancer up front. But often we catch those big prostate symptoms are really kind of the starting point to have that discussion so we can hopefully catch everything very early. Dr. Loeb, did you have anything to add?
I do. This is actually an area of misinformation that we've been seeing online a lot. This idea of the symptoms of prostate cancer, and usually early prostate cancer doesn't actually have any symptoms at all. And as you mentioned, any symptoms that may be occurring are typically from growth or enlargement of the prostate, which is not the same as cancer. It's not even related to the cancer. So I think it's really worrisome that there's this misinformation like that you would have to have symptoms. Actually, like, the reason why screening is so important is because most early prostate cancers have no symptoms. So you might be feeling completely fine. And therefore, the only way of determining early that there's a prostate cancer there is by getting the PSA blood test or the prostate blood test.
I completely agree. I think the feeling fine is a great time to have that discussion about prostate cancer screening well before any problems arise. So just want to emphasize that as well.
Really going on that topic, can you guys explain screening options? I know somebody hears prostate screening, it can sound a little bit scary, but I know that there's definitely multiple options for different cases.
That's a great point. And that's another myth that's going around, like prostate cancer screening is scary, especially because of the prostate exam, which would involve, placing a finger into the rectum to feel the prostate. The good news is that that's actually moved more to the second line nowadays. And so the main screening is just through a simple blood test. It's called PSA, prostate specific antigen. And, many people are having blood work on a yearly basis or thereabouts anyway for other reasons. So it really, doesn't add any morbidity to get this blood test if you want to learn more about your risk of prostate cancer. Now, it's not a perfect test, just like many tests in medicine. Sometimes you could get a suspicious result and it isn't always mean that it's cancer, for example, but it is the best test that we have and the easiest way to find a cancer early.
Completely agree, Dr. Loeb. I was just going to add to that. Oftentimes patients will say, "Oh, those who know will ask, oh, what's my number? Is there a way to drive that number down?" And I really stress with them that PSA test is really for us to start the discussion of risk and go down the path of screening and evaluation, but it's not going to be a direct measure of cancer burden. So it's not going to tell you exactly how much cancer is there, or even if it is there. But it's an important first step for us to understand what's going on in the prostate, and then what we may need to do as the next steps after.
Yeah, sometimes I tell patients it's kind of like the check engine light that goes on in the car. It doesn't tell you like what exactly is wrong, but it does tell you that you need to go to the shop and someone needs to look under the hood and figure it out. And so you could think of the prostate blood test like that. If it goes up, it could be that the prostate's just growing. And so it's making more of this substance. It could be that there's some inflammation and more of this is leaking out into the blood. Or it could be that there is a small tumor there that's producing more of this prostate substance. And so that's why it went up. So it could be cancer, but it could be other things. And it requires going to get checked out to look under the hood and figure out what exactly is it that's happening in there.
And that's a great point. I was just going to bring up that also means you don't necessarily jump straight from PSA blood test to biopsy procedure. There are other tests and imaging studies that we have now to check under the hood. So getting that test doesn't sign you up for a procedure, only that discussion. So that's really important too. If the concern about jumping to a procedure or something invasive is the barrier to getting that test.
Along those lines, we talked before, and some of the myths that you mentioned were that prostate cancer is just for old men, or that since no one in my family has it, I won't get it. Are you guys able to touch on those myths a little bit?
So we often think of prostate issues in general in older men, but we know that prostate cancer can happen in younger men. We know that some groups are at higher risk of it potentially starting earlier. And we know that younger men with prostate cancer can be treated effectively for this. So knowing that number up front is always a good thing. And understanding if there is cancer present and then what type of cancer it is early is, again, catching it while it's contained within the prostate is the key. We want to catch everything while we still have all the options available for us.
Yeah, absolutely. This is definitely not just a condition for older adults. Younger men can also be affected by prostate cancer. And so that's definitely important to know. And actually, another myth that we came across in our research, Dr. Washington and I were collaborating on a study recently looking at, the online information environment about prostate cancer. And we found that Many of the websites and social media posts about prostate cancer don't feature diverse populations. So in our research studies, some Black men with prostate cancer expressed that they never saw anyone like them in any of the materials. So they thought that either Black men were at a lower risk of prostate cancer or maybe don't get it at all, which is actually exactly the opposite. So it shows, the importance of representation and online information, but also just how some of these things that you see may be misleading. So we definitely want to get out there, the important information that Black men actually have a higher risk of prostate cancer, and it's very important to get screened.
Yeah, I completely agree. And I just wanted to stress that the people attending this webinar will see those facts and those numbers. And this is an opportunity for all of you to also tell your family members those numbers, to try to challenge what they may be getting from social media, any type of unvetted source on the internet, as broad as that may be, about these numbers. And this can really be an opportunity to get someone evaluated, catch something early if it's there.
Absolutely. And sorry, my camera's off. Going off of that, talking about screening and detection, can you guys talk a little bit about active surveillance, and does every case require surgery?
I can start us with this one. So we often discuss active surveillance as a way to closely and safely monitor disease that may not need surgery or radiation up front. We often think of cancer as it not being there, or it's there and we need to operate or radiate or give some medicines for it. And we really found that there's potentially a third group that doesn't behave the way we think cancer typically behaves. And that has allowed us to avoid exposing patients to the side effects, morbidities of surgery or radiation up front, and give them a window of time to avoid those potential side effects without risking worsening of their disease. And that's really active surveillance. But people often think of this as watchful waiting, just kind of ignoring something till symptoms come up. And it's really very different. It's a close monitoring schedule. And the issue is really timing. So do we need treatment now, or could we get it later safely?
I agree. Active surveillance is really a great option. Many prostate cancers, thank goodness, are found at an early stage and are favorable risks, meaning that they have a really long course and, grow very slowly or very indolent type of behavior. And so in those cases, this is a wonderful option to avoid any, added side effects that may occur from prostate cancer treatment, and just follow closely. And, you can see over time if things are changing. If your numbers are going up, or you have another biopsy and the cancer looks worse than it did previously, then the goal is to be able to still offer curative treatment, hopefully preserving quality of life for as long as possible until such a time as that treatment may be needed.
I would just stress that active surveillance is an option for all men after having the discussion and understanding what the disease looks like. Just because of who you are from different backgrounds doesn't necessarily mean that active surveillance wouldn't be an option. But it does require a discussion with your urologist and your doctor about this.
Talking about the importance of getting tested in all these populations and everything. How can men best advocate for themselves?
I think it's important just to have these conversations, to speak to your doctor directly, and also share your family history, your own risks and preferences. There's a lot of different options when it comes to prostate cancer. So just, being very clear as to what's most important to you, especially if you've been diagnosed with prostate cancer and you're trying to choose what type of treatment may be best. Fortunately, we're at a great place where there's many effective treatment options, but they do differ in terms of how they might affect quality of life and what the monitoring might be like afterwards. And it's really important that you do some soul searching to figure out what is most important to you, and then share those preferences openly with your healthcare providers so that they can help give you guidance on what might be the path that's going to be best for your individual situation.
I completely agree. And, what we say in a lot of our community events is kind of know your number. So knowing your family history, knowing what that number is kind of the really key first step for you advocating for yourself. And that can be a hurdle in and of itself, getting the test, that blood test, that is the PSA. So understanding what that number is, understanding what's important to you, and understanding how your family's been impacted by prostate cancer or other cancers will all feed into that as well.
All right. And we have a question. Someone said they see a lot of info now. They see a lot of stuff going on, and they're wondering, are cases in prostate cancer rising, or how is it developing?
Well, it still is the most common cancer in U.S. men. And the good news is that survival rates have improved a lot over the last few decades. So I'd say, unfortunately, it is still extremely common, and many men will face this during their lifetime. But on a positive note, we have a lot more to offer actually throughout the entire continuum of the disease, all the way from, better options in terms of even screening and detection for prostate cancer, more options for the management of early stage cancers, and many more options for advanced cancers.
Absolutely. And one question that just came in, what exactly is the prostate? What does it do? Kind of should have started there from the beginning.
I'll say the prostate, or prostrate as it's often called, sits between, quick anatomy lesson, sits between the bladder and the penis on the inside the pelvis, so inside your body. So that is a area that helps create fluid for the ejaculate. And right through the middle is where a lot of the urine passes through from the bladder. Well, all the urine passes from the bladder through the middle of the prostate into the urethra, or the tube that travels through the penis to the outside world. So it sits there and doesn't typically cause too many problems until you have to see a urologist.
And another question just came in. What are some of the side effects of, prostate cancer treatments? What are some things that might distinguish if someone wants surgery, active surveillance, kind of going around there?
Well, for active surveillance, I think the main side effect is just that oftentimes biopsies are done every couple of years to check the status of the cancer. And the biopsy procedure can have some risks, things like bleeding or infection, or even urinary issues occurring after the biopsy. Treatment, it really varies by the treatment, but all forms of prostate cancer treatment can have some sexual impact. And this could be a range of things. Erectile dysfunction is certainly a big one and gets most of the airtime with respect to this topic, but there can be a range of other sexual impacts, which can vary between treatments. Some can affect, for example, ejaculation, orgasm. There may be changes to the penis, such as penile shortening or penile curvature. Some forms of treatment may affect libido or sexual desire, or even involve leakage of urine during sexual activity. There may be other types of urinary side effects with some treatments, like urinary leakage or urinary irritation. Some treatments could actually affect the GI tract, or, making poops or having more, irritable bowels. And then, hormonal issues. If you are somebody that's taking hormones or other drugs for the prostate cancer, that could affect things like energy and libido, muscle mass. So there's a lot of different things that can happen, but I don't want this to sound doomsday, because thankfully we have lots of great options to mitigate these issues if they do occur. And, since the risk of these different things does vary a lot between different treatment options, that's why it's especially important to learn exactly with each type of treatment that you may be considering what might occur, and to be very frank and open about your own preferences and activities to try to preserve what's most important to you.
I agree. It requires a discussion up front. Oftentimes, I'll kind of ask the urologist, what's the best thing for me? And they have to understand what the risks are for each treatment. And sometimes that discussion is the patient alone. Sometimes that is a discussion with the patient and their partner, significant other, family members, to understand what life would look like after treatment if they need it. So that discussion up front before making the decision to understand all the different options is crucial.
Now, someone just asked, they said, we mentioned Black population needs to get tested earlier. Are there any other populations or people who might want to consider getting tested earlier than later?
Well, one very important population are people who have a family history of prostate cancer, or, multiple cancers in the family, like breast, ovarian, colorectal cancer, or who have a known genetic risk factor like BRCA, which is a gene that's associated with earlier prostate cancer, or Lynch syndrome, which is another genetic condition. So, of course, people, if they are aware that they have these genetic factors in their family, this is an important group. But, to tell you the truth, I advocate for initiating discussions about screening in the 40s for everyone, irrespective of risk factors, regardless, because your baseline PSA measurement itself actually gives a very clear picture as to your future risk of prostate cancer. So you may have no known risk factors at all, but that baseline PSA level can tell us a lot about the likelihood that you'll ever get concerning prostate cancer in the lifetime. Dr. Washington, what do you usually tell people about this?
Yeah, I tell people there's always discussions of when should I start. But I agree, knowing that baseline number before any problems arise is key. And that in and of itself, information. Knowing your family history, more information. And we have ways to assess your risk without, again, any invasive procedures. So as much information as we can have up front helps us inform what those next steps would be in your risk of having cancer versus cancer that would need treatment up front.
All right, another question we just got is, I'm nervous to talk to my doctor. How do you suggest I bring up the subject, and how do you suggest I talk to my doctor about this?
So I think that this can be an interesting question to ask with the power dynamic between patient and provider. But I think having an honest conversation, I'm interested in prostate cancer screening, I want to know what my baseline number is a good way to start. It's a simple blood test. And then that requires sometimes more discussion with your primary care doctor. It's not always going to be the urologist that you'll see first, but having that discussion with your general practitioner, primary care doctor, to let them know that you want to understand your risk and your baseline number is a good starting point. Anything else you want to add, Dr. Lu?
Yeah, that sounds great. I agree completely.
All right. Well, that is actually the end of all of our questions. I'm going to end up here a couple minutes early, but thank you so much, Dr. Loeb and Dr. Washington, for talking with us. We're going to record this. We have recorded this, and we're going to put this up on social media for people who have more questions. We'll get back to you. Thank you so much for taking your time, and I hope that everybody has a great day.